Good morning, one and all. Today, we are going to discuss the continuation of the case history. These are the following contents we are going to discuss in this class. They are chief complaint, past medical history, past dental history, family history, and personal history. Coming to chief complaint. What is chief complaint and how to record it? When a patient comes to you, the first question after recording the demographic data, you should ask why he has approached you. Chief complaint should be recorded in patient own words. You should not misinterpret because there will be a loss of meaning while converting. So you should record the patient's own words. Recording chief complaint in the patient own words may provide insight into the nature of the problem, and the symptoms should be recorded in the chronological order with duration. Definitely, you should make sure that the patient will be going on speaking whatever the number of complaints he has. So you should take into the criteria of making sure that in a chronological order, that is, the first chief complaint should be the main complaint what he is going to speak the first. So multiple complaints are listed in the order of importance to the patient, and it aid in the case of medical legal problems. The main aspects of asking this chief complaint also might lead to the knowing to the problem of in the case of medical legal problems also. Note: so do not use the words anterior and posterior. Instead, use the words front and back region. Why this is because there should not be a misinterpretation of what the patient has been spoken to you. So you should not use the medical terminologies or whatever the terminologies you know. You should make sure that you should write the complaint in the patient own words. For example, patient complains of pain or decayed teeth in the upper or lower, right or left, front or back tooth region of the jaw. Patient complains of deposits on the teeth. You should not tell that patient has came for cleaning. You should write patient has given the complaint of deposits on the tooth, or the patient says there is a mobile tooth. You should write the loose teeth, or if he says the stains or calculus or debris that is present on the tooth, you should record it as deposits. If he says there is a halitosis, halitosis is the terminology which is being spoken by us, so you should make sure that you should write as a bad breath. If he says there is a edentullousness, that means if he says that I came for construction of the two structures, or if he wants to replace the missing teeth, you should write it is as missing teeth. Don't ever write the terminologies like edentullousness in the chief complaint. And if there are more than one complaint, the record according to the order of importance to the patient. It was given by Gary Coleman, has said that you should record the complaints in a chronological order based on the importance where the patient has given the primary first complaint, and in continuation with those complaints it should be recorded in that order. According to Oxford English Dictionary, complaint means a grievance or cause of dissatisfaction, a statement of dissatisfaction, or an ailment or illness. Hence, do not use the terms which reflects desire or need. That means he wants whatever the patient complains. For example, if the patient complains of saying that I want to replace his missing tooth, it is not the complaint. What is the need? It is the need, because the complaint might not be a need to be satisfied. It should be a complaint where the problem to be satisfied. So if the patient says that I want to replace my missing teeth, you should ask the question why? What is the need of replacing the teeth? Then the complaint will be as if the patient says there is difficulty in chewing, or difficulty in speech, or difficulty in aesthetics. So for example, if the patient wants replacement of teeth, it is the wrong statement. You should record as patient complaints of difficulty in chewing or speech. If the patient says that he wants his teeth or tooth to be clean, okay, patient wants his or his teeth to be clean. If the correct sentence is patient complains of deposits on the teeth. So you should make sure that the complaint should be in a appropriate way of writing that in his patient's own words. In the chief complaint, you should ask regarding what is the establishing reason for the dental visit. The appropriate open question should be like, what is the main reason for you coming to see me today? Inappropriate closed question says, are you having any problems? It should not be in a way where we should ask and know the problem in an easier manner. Okay, so tell me how I can help you. This is the correct way of asking the questions. Or tell me what I can do for you. Is there anything else that bothers you about your teeth? Tell me more about that. This is the way where the appropriate open questions should be recorded. Inappropriate questions like asking that, are you having any pain? It's just a checkup, is it? Note, if there is the patient's answers are yes to these questions, the dentist is a long way of finding out what is the problems of the pain. So it is always wise to give for open questions. If you ask like the closed questions, definitely the patient says yes or no. It means that you are not in a proper way of knowing the problem or insight of the problem where the patient has been suffering from it. So make sure it should be an appropriate open questions of knowing the problem intensity or whatever the problems he is facing with the oral cavity. Coming to history of present illness. It is the chronological account of the chief complaints and associated symptoms from the time of onset to the time when the history is taken. So after the chief complaint, the history of present illness is written in the dentist's own words. So the first thing should be recorded in the patient own words, but the history of present illness might be elaborative method of knowing the chief complaints, insight and intensity of the problem. So it is an elaboration of the chief complaint with onset, duration, progress and initiating, aggravating and leaving factors. For example, if this patient says he has pain, so you should ask location, mode of onset, intensity. Like for example, if it is the conditions of like mild, moderate and severe, but you should know what types of pains are there, how many types of pains are there and what is the nature of pain. You should not write regarding it is a mild, moderate and severe. It might be an intensity of the problem that is being explained by the patient, but you should write in a medical terminology of what is the type of the pain and the nature. So the next is the duration, whether it is a referred pain, what are the aggravating factors and what are the relieving factors. If the patient complains of, for example, I would like to say, if the patient complains of pain in the right lower back tooth region since 1 week, this is where the chief complaint might be in a similar singular term, but the history of present illness will be in an elaborative way of asking it. Like for example, the location, as I said, it is in the right lower back tooth region. Mode of onset, what is making sure or what is the mode of onset of aggravating or the pain that is causing, and what is the intensity, that is it might be the pain, what is the types, that is for example, what are the types of pains. There are different types of pains. They are throbbing, lancinating, stabbing, okay, referred pain. These are the types of pains. And what is the nature, how the nature of the pain is, and what is the duration, as if the chief complaint has been given that. And if it is a referred pain where there is aggravating factors which is causing the pain on the tooth structure and it is going on transmitting towards the entire jaw. And what are the aggravating factors, whether the aggravating factors might be at the time of taking food or taking cold or taking hot substances, or and if the pain is there, what are the relieving factors. For example, how you are getting relieved from the pain when it caused. The patient definitely explains regarding he has taken any medications or if he has taken a home remedies or if it is subsided within a 1 hour. What are the time things that is being explained in the history of present illness. If the patient has given a complaint of swelling, definitely by looking with the patient's face you can come or you can go through that there is swelling that is present. If the patient says regarding the swelling, then the question should be on the mode of onset, duration, progression, associated features, like for example if there is any swelling or if there is any abscess or if there is any cyst that has been found, or definitely it causes fever, what are the secondary changes? If there is a secondary changes that has been seen in the area of the swelling, that is like for example ulcerations or impairment of functions, or if any recurrence that has been happened earlier, like for example the pain is there, if any recurrences that has been happened of going on with the swelling, definitely the question should be in that way of asking the history of present illness. For example, in the same way, after the pain or swelling, likewise, if there is patient complaints of deposits, you should ask the questions like, since how long, that is the duration, when the patient has first noticed the deposits, noticed by himself or someone else has told him. Ask if any changes in the color and quantity or any associated symptoms like bad breath or bleeding gums. This is the way of appropriately asking the elaboration of the questions in the chief complaint while writing the history of present illness. Likewise, for example, the patient complains of decayed teeth. If the complaint is the decayed teeth, if the patient says there is a decayed teeth, definitely you should write the decayed teeth only. If you should ask the questions in the history of present illness when the patient has first noticed it. What is the size and what is the color of the lesion when he or she first noticed it, or any color changes or in the size in the overtime, or any associated symptoms like whether taking of cold or hot substances, any tingling sensations or mild pains that is causing in the dental caries region. The history of present illness for a patient requesting a checkup consists of the duration since the last dental examination and the information that the patient has no specific dental problems. It is definitely the history of present illness cannot be asked. If the patient complains of the thing, I came for checkup, then the history of present illness is nothing of asking any questions, definitely doesn't mean for it. So never take a patient with a regular checkup. So make sure if the patient complains of any types of pains or if any types of conditions, definitely the intensity of asking the history of present illness or elaborating of the chief complaint can be made. So I would like to say that what is a symptom? It is defined as any change in the body or its function which is perceptible to the patient and may indicate a disease. That is a symptom that can be felt by the person, that is the patient itself. It might be a pain or fever. It is like symptom. Sign. It is defined as any change in the body or its function which is perceptible to a trained observer and may indicate a specific disease. Like for example, bleeding on probing or pockets which is being identified by us. It is a sign of the problem that the patient is facing. So make sure the difference between the symptom and the sign. Coming to past medical history. After the chief complaint and the history of present illness, you should know regarding the first thing regarding past medical history. It is a review of the healthcare experiences and the medical conditions that have been diagnosed. That is, it is a description of the relevant features of the patient's health status from birth to the moment where the patient enters to the dentist office. All conditions and diseases which have a direct or indirect effect on the oral health and treatment underwent should be definitely recorded. So make sure that regarding asking the past and the current medical illnesses and the hospitalizations and blood transfusions and characteristics of infections and the immunizations that has been undertaken by the patient, and also any exposure to the radiation. This is where you will be in a safe and you should take care of how the prevailing conditions the patient has. Whether the patient is on any medication. If so, then note down the medication and reason for which it has been prescribed. You should ask the patient whether he is being under current medical treatment, that is recent hospitalizations for any types of conditions, that is you should ask whether he has been admitted for any types of reasons or if he has gone for any types of treatment to the hospital, and also to avoid the possible disease contact. This is the main reason why we are being asking the possible past medical history, and also ask the questions regarding any types of allergies, regarding the drugs or food he has been allergic, and also regarding the pregnancy. You should be take care of asking these types of questions regarding the pregnancy by seeing the patient's age of asking and knowing the demographic details. And one more thing, you can ask regarding if the patient is a female and ask regarding the menstrual cycle also. It gives us the importance of the menstrual cycle period of what type of treatment you are going to do. So make sure you should ask the entire past medical history of knowing the patient's well-being. The main important thing is to note this point, that is, the question should not be phrased, are you taking any types of drugs, the words that affect. So the meaning becomes if he has been an addict or if he has been a person who is taking any types of drugs. The proper question of asking is, he has been taking any types of medication for any types of diseases or any types of illnesses that has been occurred in the past. Like for example, like if the patient is taking any types of drugs for medications, that is medications especially for the diabetic conditions or the types of neurological problems, you should definitely ask the question regarding the person's medications that is being taken by him. And if needed, you should record the contact number of the patient's physician or the family doctor, so that you can discuss with the physician or the family doctor so what type of treatment you are going to plan, whether you can proceed or not. Any important aspects that should be clearly marked and attention should be drawn regarding the case sheet or the work chart in the first page, making with a red star, of making sure that what are the past conditions or the past medical history that has been given by the patient. For example, the patient is a diabetic or hypertensive, or if the patient has undergone any types of cardiac surgery, or if he is in the medication of the cardiac treatments, definitely you should make sure in the topmost part of the front page of the case sheet with a red star, so that any person who is going to take, or even if any person who is going to treat, will go through the case sheet and knows the past medical condition. So this is the importance of asking the past medical history. And in the next class, we will continue with the remaining part of the past general history, family history, and the personal history. Thank you.